Hi, my name is Nabila, and I will give a summary or an introduction about the Rosie ghostly sheep. One day, when Mr. Azizi was doing his morning rounds in the main house for the lambs, he noticed that the flooring was very dirty. It was covered by soft feces. Not only that, the lambs were also dirty, and a number of them were very inactive. And he noticed that he was missing a few lambs. If I'm not mistaken, it was four lambs. Four lambs were missing. And when he asked his staff, Ahmad said that the missing lambs were actually died. One died like a day ago, whereas three died last Friday. It was a few days ago. So when Mr. Azizi was looking around, he also searched for his pet sheep Rosie. Rosie is an 11-month-old Doppler cross Damara sheep that weighs 20 kilograms. Rosie, since she is a pet sheep, she was allowed to roam freely around the farm and was dewormed. It turns out Rosie seemed dulled, non-responsive when called, and looked very depressed. So Mr. Azizi was very worried about Rosie, and he contacted Dr. Ned from College Animal Selangor Hospital. So Dr. Ned came and he looked around the farm and checked on the lambs. He checked on Rosie too. So Rosie had a body temperature of 39.2 degrees Celsius. The pulse rate was 96 RBPM. Body condition score is 2.5. Skin tint is more than 2 seconds, which is very normal and very abnormal. And the CRT was 3 seconds. So Dr. Ned, what he did was he collected some feces samples and he did some feces sampling. So a few days later, the hematology results came out, and the results were some of the results were very abnormal. For example, like erythrocyte results, it was considered very low, 3.13, because the reference is around 9 to 15. Other results also include hemoglobin. The normal range is between 90 to 150, but the results came out as 25.7. Other obvious results also include creatinine levels. Creatinine was 43. It's very low because the normal range is between 106 and 168. So my group will discuss further about the Rosie ghostly sheep. We will use the Fila table and do some mind mapping. So yeah, thank you.
Okay, so today I will talk about some facts of the situation given on 7 a.m. 3rd November 2014. It was rain heavily last night and sunshine bright on the day. And the floor was dirty with soft feces, and the lamp also were dirty with feces, and they are not active. And 4 lambs were found dead, but Rosie was fine last week. And then on 11 a.m. on the same day, 1 lamb appears lifeless, where there is no heartbeat, pale gum, dilated pupils, and most of the lamb are very lethargic and pale. The floor were covered with pasty feces. The body were covered also with feces and soil. The sheep had been dewormed last month. So for the farm background, the sheep in the farm had been traded off from other farms, and the fecal material of the farm are being used as fertilizer. And there are 2 big fish ponds near the farm, and the owner also run a plant nursery nearby.
Okay, so moving on for the management of the Mr. Azizi farm. So the management is semi-intensive, and then the sheep were allowed to graze at 9 a.m. until 3 p.m. and then 3 p.m. onwards they were fed with soya byproducts and also the pellet. And then sometimes the workers did or do the cut and carry leaf or plants by the roadside, and the plant and the leaf is napier. And then heavily sheep also graze around the neighborhood and then also the farm. This is when there is not many manpower. So the nursing and lamb house is located behind the homestay chalet and nearby the fish ponds. And then the pens will not be clean if there is a short of staff. So meaning that there's less manpower at that time. So the pens will not be clean now. And then the farm, Mr. Aziz's farm will be tested brucellosis yearly by the DPS Selangor, Department of Veterinary Service. And then the common problems found in the Mr. Azizi farm is respiratory problems and the parasites and also the maggot wounds. And then the only medicine available in the farm is amoxicillin, ivermectin, albendazole, and then vitamin B complex. The amoxicillin is for antibiotic, and then ivermectin and albendazole are mostly used for endoparasite like herpes, something like that. And then moving on to the Rosie, the sheep that we focus on today, she is 11 months old, and then Doppel cross Damara breeds and weight 20 kgs. And then Rosie is allowed to roam freely in the farm since she is being treated as a pet by Mr. Azizi. And then Rosie also dewormed last month, same as the other sheep. And then upon the physical examination, she appeared dull and depressed. And then TPR, T is temperature, the body temperature of Rosie is 39.2, is not really almost abnormal lah, above. And then the pulse rate is 96 beats per minute, and then the pulse rate is 44 beats per minute. And then the body score is not that bad, 2.5 out of 5. And then the skin time is more than 2 seconds, which indicates that Rosie is dehydrated. And then 3 second CRT capillary refill time means that Rosie is also meaning that the blood flow is not that fast. And then she also got the enlargement of submandibular area, and then edematous.
The lymph node
And the lymph node also. So when the lymph node getting enlarged, so it also cause the submandibular area enlarged. And then the fecal staining also can be found in the Rosie body, especially at the perianal and caudal part of the hindwings.
So here we're going to discuss about the idea from the fact that we get. So we just finished discussion about the fact, and we're going to talk about the idea that coming from the fact. So the idea that we have discussed, which is diarrhea, the herd having diarrhea and dehydrated based on the clinical sign, which is pale mucous membrane, CRT more than 3 seconds, and skin tan more than 2 seconds. So the next thing is the sheep have bottle jaw, which is enlargement of submandibular, and the third thing is it is infectious disease, because many sheep having same clinical sign, so it is infectious. So the next thing is infected disease. The next thing is not a parasitic infectious, because from the history we got that the herd have undergo a deworming program, and thus it tells us that it's not a parasitic disease. So maybe it's bacteria and virus. So the next thing is we suspect the route of transmission is fecal oral transmission, because we couldn't find any clue other than feces all around the pen. So at the end of the day, based on route of transmission, clinical science, and we eliminate the parasitic. So we we suspect the disease that the herd having is Yoni disease infected by a MAP. That's all about the idea.
Okay.
Okay, for my part, I will tell you guys about learning outcome. Okay, from the idea that we got, what is actually the another idea that we want to know from the ideas that have been explained by SN is actually what is another route of transmission instead of the fecal contamination. Maybe it can be injection from the feed or inhalation by the aerosol from another goat. Another learning outcome is we want to know the pathogenesis of the MAP that that differential diagnosis that we get from the fact is actually is Johnny disease, right? That infected by MAP. What is the pathogenesis of MAP itself? That is we want to know from the idea. So we can discover how it's infect the animal. Another thing is farm management. The farm management farm management itself can lead to the transmission of MAP. Like we know that the management of the farm is located near to the pond, and also the management, the grazing rotation. That we know that if there is manpower problem, it's given that different nutrition being given to the animal if there is insufficient manpower, and also the time for the rotation also is different if there is not sufficient manpower. Farm management also can lead to the transmission of MAP. And also another thing is how to know that from the what SN tell us is that is a pathogenic disease, right? What is another test? What is the confirmation that we want to know? Actually, that is not parasitic, but is a pathogenic. What is the main features that we want to know? Another thing that we have to consider is how to prevent this disease. How actually the thing that we must do to prevent this disease from infected to another herd of cow, because we know that the farm is large, right? Another than that is differential diagnosis for the bottle jaw and also diarrhea. Maybe there is another disease can cause a same clinical signs such as bottle jaw and diarrhea. What is another diagnosis, a differential diagnosis from that two clinical signs? And also the last one is how to diagnose Johnny disease, maybe from a PE or from a clinical sign. What is a specific diagnosis that we want to know? What we want to know the Johnny disease. That is the learning outcome that we want to know from the idea. Now the next we move to
So we as a veterinary came up with some action plan. So here are a few action plans that we are planned. Firstly is make sure the farmer keep the lambing area clean and dry, because the kid that being delivered by the mother are more susceptible to this bacterium, which we call is Mycobacterium avium paratuberculosis. So this due to the kid have low immunity level inside the body. And next is make sure the farmer must avoid feeding the infected colostrum or milk, as we know this type of bacterium can be infected through the transmammary. So the kid be able to get this type of disease through the milk. The third one is make sure to prevent the exposure of ewes to milk and their manure, because the MAP is more resistant towards the fecal. And then the last one is make sure to prevent the fecal contaminations of feed and water within the kit. So this how we prevent the MAP towards the kit.
Okay, I want to add some point of action how to control and prevent these
Mycobacteria avium paratuberculosis. The next point is to prevent introduction of infected animals. Since Mr. Azizi doesn't provide a special room for infected animals, so maybe Mr. Azizi can prepare a room which is a quarantine room to quarantine those infected animals from the healthy animals. Okay, next, limit the grazing area. Maybe the workers should limit the grazing area of the animals so that the animals cannot graze at neighboring area. And then increase labor force. As we all know, this case has started from the problem of labor force. They are short in staff, so in order to overcome this problem, Mr. Azizi should increase the labor force. The last one is temporarily close the farm. This is to completely clear the farm from MAP. That's all.
Hello, I am Nonaja Atika. So upon our discussion on the first case for PBL, which is the Rosie the ghostly sheep, we have found out that the sheep may infect with Johne's disease. So Johne's disease is actually a disease caused by a bacteria called Mycobacterium avium, which is the subspecies of paratuberculosis. So this bacteria can affect the sheep, can affect the epithelial wall of the small intestine of the sheep, which will cause the sheep to be malabsorption and also malnutrition. So malabsorption can cause diarrhea, which is one of the clinical signs of the sheep, while malnutrition can cause the sheep to be inappetence and also loss in its body weight. So we have chosen this Johne's disease rather than other differential diagnosis because this Johne's disease, because the sheep has got some of the clinical signs related to the Johne's disease. That's all. Thank you.